Good morning, good evening, good afternoon. This is Dr. Garais for MED104 Medical Terminology. And we will be doing now chapter 5. Running. Here you go. Chapter 5 is the nervous system. And the two specialties or doctors that you'll see who are involved in the nervous system is neurology and psychiatry, brain and nerves, logi, study of, psychiatry, psych, the mind. So neurology deals with more of the anatomy of it all, and psychiatry more of the physiology of it all, or the psych or the mind. Nervous system, it's essentially a sensory. It picks up information, and then of course the brain integrates and then makes decisions about it. And then there's a motor function of it, which get to motor or you get to do things, and that also describes your muscles. The two major communication systems in your body are your nervous system and your endocrine system. And if you think about your nervous system, it's pretty fast. So you have the central nervous system and the peripheral nervous system, also known as your CNS and your PNS. Your central nervous system is your brain and spinal cord, and it's really important. And that's why it's called the central nervous system, not because it's centrally located, but it still is. But if anything happens to peripheral nervous system, you probably won't die. You'll have disability, but you won't die. Things happen to your central nervous system, there's a great potential for death. There's things in your nervous system that you can control, those are voluntary, and there's things that you can't control, involuntary. And we discussed those two terms in the previous chapter. Okay, so psych or your mind, and that has emotions, opinions, and beliefs. And psychiatry and psychology both deal with the mind. Logi, study of the mind, psychiatry, Department of Medicine that deals with the mind. The difference is the psychologist, the clinical psychologist, is a PhD. They cannot prescribe medications, and psychiatry is an MD. They can prescribe medications, and there are uses for both these professions, and they both rely on psychoanalysis. Psych meaning mind, analysis, ana parts, lysis breakdown. So they take very, very good histories, very, very long and extensive histories to get at what's going on with your thinking, what's going on with your emotions. Sensory system, that's your special senses are everything that's located in your head. So that's your eyes, ears, nose, and skin. And your brain is kind of like a control center. It's kind of like the integration center, and then it decides what to do. You have sensory that pick up, signals that your body picks up from the outside world, and then you have the motor system, which is connected to your muscles. So then you get to do things about it. I'm going to skip through this part because if you recall, don't want to devolve into a anatomy and physiology lecture. You'll have more of that when you get into anatomy and physiology if you have not done so already. So brain, cerebroencephalo. So we have already learned a lot of these words or these suffixes, and then you attach it onto these combining forms here, cerebroencephalo, which both of them mean brain. So I could ask, which of the following is the disease process of the brain? Cerebropathy. What is cerebrospinal fluid? Is it fluid in your brain, spinal cord, both, neither? Encephalitis, inflammation or infection of your brain. And then encephalogram is a the actual measurement of your brain. And we're gonna know the acronym EEG, which is electroencephalogram, and also known as a sleep study. That is the measurement of the electricity of your brain. Cerebellum, structure of, it's also part of your brain. Nice to know. Cerebrum encephalo, must know. Lobectomy, lobotomy. Lobes are sections of body parts, and your brain has sections. So does your liver. So does your lungs. If I cut into one of those sections, that's a lobotomy. If I remove one of those sections, that's a lobectomy. Microcephaly, macrocephaly. Cephaly, process of your head, right? And that process, micro, that means your head is shrinking. Macrocephaly, your head is growing. Remember my story from the hydrocephalus child that I took care of for 58 days. Some days I say it's 58, others it's 60. Depends on how sleepy I am. Um, Craniotomer, craniomalacia. See, a lot of this, I just had deja vu. A lot of this we already kind of went over. But you could see it's like wash, rinse, and repeat. Craniometer, crani, cranio, craniometer is something that measures a machine, or it could be a CT scan, it could be um, uh, a bunch of things. It could be even tape measure. Craniomalacia, and these words sound so familiar. Well, maybe it's because I did it earlier today, and it's really, really late or really early, depending how you look at it. Your meninges are coverings of your brain. So meningitis, inflammation or infection of the covering of your brain. Meningopathy is pathy, the disease process within the coverings of your brain. Your dura, or your dura mater, or the tough mother, is the outer covering of the meninges. Epidural, epi, right on top of that dura, and that's that you have an epidural medication or epidural diagnostic procedure, also known as a lumbar tap, and because we tap between L3 and L4 of your lumbar spine. Subdural hematoma, that's right underneath the dura, right underneath that tough layer, and you can have an oma, a a tumor or a lump or a bump of hemat, blood. Neuro is nerve, so nerve pain is neuralgia. The process of disease in your nerves and your brain is called a neuropathy. Ganglion, like a gang. A gang is a bunch of something. So a ganglion is a whole confluence or a bunch of nerves all knotted together. Um, Myelitis. Remember we talked about like spinal cord and bone marrow. That's what myelitis is. Good to know, and we've seen it in 2 chapters, so could come out. Excuse me. Anesthesia. The Department of Anesthesiology, study of and no or not aesthesia, feelings. Hyperesthesia is too much feeling. And remember, we talked about hyperesthesias and paresthesias. That's when you get pins and needles. Aphasia, that's a state or condition of no talking. Frenetics, you should know that's not, it's like voodoo science. But psychology, logi, study of psych, your mind. Somno, which I am right now, I'm a bit sleepy. Somno, somni, hypno, they all mean sleepy. So we could do this. Which of the following words means the process of performing a sleep study or recording a sleep study? That's somnography. What is my patient can't sleep? A state or condition of no sleep. That's insomnia. And hypnotic medication is, or hypnosis, cis, state or condition of hypno, sleep. And hypnotics are a classification of drugs that make you sleepy. Um, Nos, we know, means knowledge. So diagnosis, state of complete and thorough knowledge. Prognosis, state of pre or before knowledge. And agnosia is a state of condition of no knowledge. Agnosia, kind of like amnesia, kind of like partially of dementia. Agnosia, nice to know. Diagnosis, prognosis. We already had them in other quizzes and other things, but definitely a must-know word. Pyromania, kleptomania. Mania is when you're super happy or like super motivated. So if a pyromaniac, they're super motivated to play with fire. A kleptomaniac, they're super motivated, super happy to go steal something. Phobia, the exact opposite. If my patient is experiencing photophobia, that means they have an aversion towards light. There are several medications that make you have an aversion or make you like really, really super sensitive to light. And that's also the reason why if you see many elderly, they're wearing, those wraparound, very, very large sunglasses. Hydrophobia, fear of water. Hemiparesis, that's paralysis. Hemi means half. Dystonia, tono, we talked about ataxia. Remember that was contraction or movement. See, you see a lot of stuff that's repeating itself. Myasthenia is repeating itself. Quadriplegia, and remember, a quadriplegia, state or condition of paralysis. Quadri means what? All four of your appendages, which is both your arms and legs. Peripheral nervous system, central nervous system. Nice to know. Anxiety, depression, phobia. Now, dementia. Dementia is really part because that's very common for a multitude of reasons. And dementia, think memory loss, either acute or chronic or even progressive. Acute, my memory loss just happened right now. Chronic, it happens over a course of time. Progressive, that means my dementia gets worse. For example, Alzheimer's, they don't get better, they get worse over time. Retrograde, retro means to go back. So that person, they can remember new stuff, but they can't remember old stuff. Okay. Ataxia. Oh, catatonia. We talked about tone. That's like meth heads in Kensington Avenue in Philly. They are in a catatonic state. Dyslexia. State or ia, remember, is the suffix, a state or condition. Dys means abnormal. Lex means reading. So if a person has difficulty reading, and it's more difficulty reading, it's also a sensory problem and not only a sensory slash visual problem, it is also a brain processing problem. Tonic-clonic, it deals with seizures, a myoclonic seizure, muscle, myospasm. That just happens. It could be a sign of something abnormal, or it could just be, every once in a while, you get a twitch in your arm, or you're twitching your foot or the leg, happens. Somnambulism, nice to know. Insomnia, we already saw. Syncope, I want you to think fainting. So syncope, fainting. Neuralgia, neurodynia, oopsies. Paresis, hemiparesis. See, a lot of it is you've seen it before. Pausalgia, nice to know. I could ask about the different phobias. Which is the fear of heights? Acrophobia. Which is the fear of going outside? Agoraphobia. What's the fear of water? Hydrophobia. What's the fear of light or aversion to light? Photophobia. See, it's repeating the same stuff. So we went through this CTM, but we didn't go through ultrasound. And remember, cerebrospinal fluid is fluid found not only in your brain, cerebrum, also in your spinal cavity. So doesn't that look like a beautiful both A and B question? And ultrasound that uses sound above the level of hearing. Lumbar puncture, LP. Remember, we talked about that. It's in the between your L3 and L4, or your third and fourth lumbar vertebrae. Myelogram is the actual recording of your myelo, which is, geez, I can't remember myelo. Don't confuse myelo with myo. Myo is, of course, muscle, right? But myelogram deals with, oh, why can't I remember? Well, it's because I'm sleep deprived. All right, we'll get back to that one. Cerebral angiography, graphy, process of recording. Angio, your blood vessels in your cerebrum, in your brain. Remember CVA, cerebrovascular accident? That's a stroke. PET scan, which is positron emission tomography. Tomo means placement or area, and graphy is the process of recording that area. MRI and MRA, similar things, but MRA does angiography using magnets. EEG, here's the big 25-cent word, but now we know it's not too special. Graphy, echo, encephalo. So it does this particular type of oh, this is not EEG. This is EEG, electroencephalography. That's an EEG, sleep study. But this echo, anything that's echo, think ultrasound. Doppler, think ultrasound. Sono, think ultrasound. Hematoma, we already went through different places, but hematoma is a very common abnormality in blood. Macrocephaly. Remember hydrocephaly? That's water. Neuritis, polyneuritis. If I have neuritis, I have an inflammation and infection of my brain and or nerves. If I have polyneuritis, I have inflammation and infection of a whole bunch of nerves. Neuroma is a tumor, lump or bump. Remember, we don't know if it's cancer yet until the biopsy comes in, but a neuroma is a lump or bump associated with your nerves. Neurosclerosis, remember the difference between sclerosis and stenosis. Sclerosis, think what? Hardening, sclare. It's a hard word, right? And then stenosis means, narrowing. So sclerosis, the hardening of nerves. If you have a hardening of nerves, there's going to be a problem. Spinal cord, myelo. Thank goodness it wasn't there. Myelo, right? It's not myo. Myelo, think spinal cord. Myomalacia, abnormal softening of your spinal cord. That's never a good thing. Apathy versus empathy versus sympathy. Apathy, your patient has no or not, little to no emotion. Empathy, we it's better to empathize than to sympathize with our patient. Sympathy is when you feel sorry for somebody, and empathy is when you understand, where your patient is coming from. We would like professionals who empathize with our patients. Nystagmus, that's when your eyeballs kind of twitch. You can look that up on YouTube. Afferent versus efferent. Efferent, this is how I remember when two things look alike. Efferent, E means exiting the brain. That means it's a motor nerve. That means it's a descending nerve. Afferent then is the exact opposite. So afferent means sensory nerves. Anesthesiology, psychiatry, psychology, we're going over that. Psychosomatic. You know that if your head is not on right, if your emotions aren't on right, you can get sick. And that's what psychosomatic symptoms are. Ik pertaining to your mind, soma your body. And I always make the analogy in lecture that you know how you get sick, like if something emotional happens to you, like a funeral, or your significant other gets into a fight with you or breaks up with you. You get kind of a cold afterwards. You get kind of sick. Psychogenic, that's generated by your mind. So, like for example, we already learned syncope. Syncope is fainting. You could have psychogenic syncope. It could be generated by your mind. Like for example, you scared yourself so much that you fainted. Pre-ictal, interictal, post-ictal. That means ictal means pertaining to a seizure. So pre-ictal is signs and symptoms that happen before the seizure, and one of them is something called aura, or aura, A-U-R-A. Like I always talk about my patient. She used to complain at me. She was complaining at me because she was saying, "Why does everyone else get blueberry pancakes?" And I didn't think anything of it. I'm like, "Lady, no one's getting blueberry pancakes. This is Department of Neurology. We don't have the budget for blueberry pancakes." Well, that's aura. She thought she was smelling blueberry pancakes, and what happened a minute later? She got a seizure, right? And of course, post-ictally, when you wake up from a seizure, you get confused, and that's also something that you have to deal with your patient, and make sure your patient's comfortable and feels safe, because they're going to wake up wondering why they were on the floor. And remember, idiopathic, that was on the quiz. A lot of people got that wrong. Ick, pertaining to idio, I have no clue. Idio, like idiots. Idiots have no clue, right? Right? There are certain things you just don't have an answer to. And idiopathic diagnoses is just we don't know where it comes from. For example, patient has a seizure. Or for me, my tremors. I have tremors, right? They did all these CTs, MRIs. I've been to psychiatrists, psychologists, neurologists, and no one knows what's wrong. No one knows why my hands shake. Well, that's called an idiopathic diagnosis. We have no idea the etiology or logi study of where it came from. Delusions, hallucinations, nice to know. CVA, must know. Cerebrovascular accident, also known as a stroke. You could have a hemorrhagic or ischemic one, and ischemia. That's a tricky word. Hemorrhagic, we know what? The patient bled out. But the most common strokes, about 60% of the time, is ischemic. I believe it's 60. Or could it be 80? I forget. And it is late. Uh, Ischemia, emia means blood condition. Isk means blockage. So if something blocks your blood vessels in your head, right, in your cerebrum, in your brain, you're going to get a CVA, you're going to get a stroke, and that's called a cerebrovascular accident. Now, what they call baby strokes or pre-strokes is a TIA, or a transient ischemic attack. They have the same symptoms as a stroke, but it's very brief, 12 to 24 hours, and then they snap out of it. The thing about a TIA, it's like a warning. If you get a TIA, you don't do anything about it, and you just keep on trucking along, and within 5 years, you're going to have a real stroke, and it's going to be debilitating. Now, what's an aneurysm? Aneurysm is and there's no way to break down that word. Cerebral aneurysm. So, of course, all of this happens in the cerebrum, or in the main part of your brain. Now, an aneurysm is when, just like when a garden hose gets really old, think of the garden hose like an artery. And when the artery or garden hose gets really old, the wall um, isn't as strong as it used to be, and then has balloons out a little bit, just like a old garden hose. The problem with the aneurysm is, and a good family friend of ours died about a couple of months ago. You can't predict it, and if it bursts, that means the patient's going to bleed out. They're going to have a stroke, and things aren't going to bode well for them. Arteriosclerosis versus atherosclerosis. Again, words that sound really close. They look like very testable items. Hint, hint, and they're very common. Artery is, of course, your arteries and veins, and the artery is the tube that takes the blood away from your heart. It's usually under high pressure. And if you have sclerosis, abnormal condition of hardening, that thing hardens, it could also burst, right? So that's arteriosclerosis. Now, what's atherosclerosis? Athero is a fatty plaque, and that fatty plaque over time is going to get hardened. So those two words are used interchangeably, but they're two entirely different things. But they cause the same thing, which is high blood pressure, also known as hypertension. Now, what's a thrombosis? Thrombosis is an abnormal blood clot. Thromb is the root meaning blood clot. Osis, suffix, abnormal condition. But what's an embolism? Embolism is when that clot breaks off and then travels. Embolisms are scary because you don't know where they're going to end up, and they cause problems further downstream, which are kind of frightening. We went through these. Craniosynostosis, not common. Hydrocephaly, I mentioned that. Hydro, ceph, head, right? Cephal, head, hydro. Encephalitis, encephalomyelitis, we went all these. Meninges, we went over those as well, the covering of the brain. ALS, amyotrophic lateral sclerosis. It means it's part of the brain. On the lateral part of the brain, it has abnormal hardening. Trophic, ick pertaining to growth. I'm not sure if amio means amyloid. I gotta look that up. Polyneuropathies, disease process of many nerves. A classic polyneuropathy is diabetic polyneuropathy. Ooh, here's them. Anorexia. It's a state or condition of no eating. Now, it's not necessarily a psychiatric condition, but when you're sick, you also have anorexia. Bulimia, that's when they purge, right? They get guilty, they eat a whole bunch of stuff, and then they vomit. Dysphoria, ia, state or condition, dys, abnormal, and four, this is how I remember it. Four sounds like form. So when you have dysphoria, you especially body dysphoria, you have a state of condition where like people who have anorexia and bulimia, they have a state of condition where they look at themselves in the mirror and they think they're monsters or they think they're like beyond ugly. No matter if you are normal, no matter how bad you look, right? You at least look in the mirror, and if you have if you're your psyche or your mind's intact, you think, hey, I don't look that bad. I look good for me. Remember the maniacs? Hypomaniac. Euphoria is what? You means normal or human. So euphoria is like, when you're happy. Manic depression or bipolar, that means they're either a maniac for a couple of months and then they have major depressive disorder for a couple of months. And it goes back and forth, back and forth. Psychosis, we didn't know, abnormal condition of the mind. Schizophrenia, we talked about word salad, and we talked about how it's actually a what is it? It's a thinking disorder. That's what schizophrenia really is. It's not multi-personality disorder. So get that out of your head. And by the way, according to my mother, um, multi-personality disorder, that's not a thing. And she'll go on for hours if you ever ask her, hey, what do you mean? Autism's palsy, think paralysis. Autism is a spectrum of developmental disorders. It could be relatively mild, and it also affects speech and social, and or it could be quite debilitating. Epilepsy, also known as seizure disorder, myasthenia gravis. Narcolepsy. Oh, that's when people just sleep like spontaneously. Again, a serious neurologic issue. Just imagine driving your car and then just falling asleep. Okay. When we look at things, we can look at things locally, right? Within the area or regionally, within a larger area. But topical means what? Right on top, right? Just like epidural. Epi is right on top of the dura. When you have topical medications, it's usually a cream right on top of your skin. That's how I remember it. Psychopharmacology, Logi, study of mind medication. Here's an example of two. There's some textbooks that say psycho would be a prefix here, or there's other textbooks that say psycho and pharmaco. They're both root words. Psychotropic drugs. Those are the drugs that will do what? They will help your mind grow, which means what? You can have hallucinations, and it'll mess with your mind. Antidepressants, of course, is against depression. Antipsychotic against psychosis. Anxiolytic. If my patient is neurotic and they have a lot of anxiety, we give them medications to lysis or break down their anxiety, and those are called anxiolytics. Anticonvulsant, thrombolytic, chemotherapy. Chemotherapy is a generalized term for what? Therapy could be medication, it could be a whole bunch of different modalities, but therapy or management strategies that deal with chemo or drugs. So it's not only cancer that has chemotherapy. Anytime you do any management with drugs, it's called chemotherapy. Endovascular surgery, nice to know. We already talked about CNS, CSF. PNS is peripheral nervous system. CNS is central nervous system. CSF is cerebral spinal fluid. MS is multiple sclerosis. And TIA is transient ischemic attack. EEG, electroencephalogram, EMG, electromyogram, ICP, intracranial pressure, LOC, loss of consciousness, LP, lumbar punch, MRA, magnetic resonance angiography, and PET scan, positron emission tomography. ADHD, which, by the way, don't tell my mother that there's such thing as an adult ADHD. You'll get several hours of lecture. That's attention deficit hyperactivity disorder. OCD is obsessive compulsive disorder. ALS is amyotrophic lateral sclerosis. CP is cerebral palsy. CVA is cerebrovascular accident. And that's the end of this chapter. Right, I'm gonna try to get some practice questions out, but you could see how the way the chapter is set up, it kind of writes itself in a way, but I'll try to get to it. Well, quiz coming up, so study, 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 and I'll see you in class. Have a good one.